Capillary collections lecture. Capillary collections are also called dermal punctures. Why do we perform capillary punctures and collections? We do this in a point of care testing for glucometers for an acute blood sugar or bleed times. We also will do them in capillary blood gases in neonates, in newborns, children, people who are difficult to draw, and tests that have a minimal volume for testing, such as a hemoglobin or a hematocrit. Capillary specimens are a mixture of venous and arterial blood along with interstitial and intracellular fluid. Portion of arterial blood is greater than the venous blood, and arterial portion can be increased by warming the site. Here's a picture of some devices that we will use. These are Lancets that can be used. In each office will have a different type of lancet. The depth should be no more than 2 millimeters for a heel and no more than 3 millimeters for an adult finger. We oftentimes will use microsample containers, which we will show you in class. And heel warmers, hot packs, and hot towels are very important in the collection. Warming increases the blood flow as much as 7-fold. So it is important to have a warm finger in order to get adequate blood supply for your test. The order of draw is purple first, green, and then red. Capillary puncture outline. So we identify the patient by the patient name and date of birth. You would then wash your hands and put on your gloves. You would then assemble the supplies needed, and then you would choose your puncture site. Avoid areas that are calloused, scarred, bruised, have edema or swelling, cold or cyanotic, infected, or have previous punctures. The heel, it is important to avoid calloused areas or the arch of the foot. Use the heel for infants less than 1 year old, and you would want to use the side of the heel. For fingers, do not choose a finger of an infant less than 1 year old. Do not choose a finger on the side of a mastectomy, and do not choose a thumb as it has a pulse. The index finger can sometimes be sensitive, and the pinky does not have enough significant tissue depth to be punctured. So the ideal fingers to puncture are the 3rd and 4th finger. Here's a picture of a dermal puncture in an adult on the middle or the ring finger. So you want to use the palmar surface near the fleshy center of the distal segment, and you want to angle your puncture inward towards each other. This will help the flow of blood and get an adequate blood supply. You want to warm the puncture site and then clean the puncture site with alcohol. Open a new sterile lancet. Warn the patient that you are going to puncture. Place the puncture tight against the skin and press the button and puncture the skin. You want to make sure that you get through to the capillary beds in order to get a sufficient sample. You then wipe away the first drop of blood with a dry gauze pad. The reason for this is this blood is contaminated with the alcohol in the skin and also will contain significant interstitial fluid. So we wipe this drop of blood away, and then we collect the specimen for the point of care testing in a micro collection container. Do not touch the collection tube to the puncture site. Excessive milking will cause hemolysis among the red blood cells and may cause inadequate results. Mix the specimen if appropriate and apply pressure and a bandage to the finger. You would then want to label the specimen. If an insufficient specimen has been obtained, the blood has stopped flowing, the puncture must be repeated at a different site using a different lancet. You want to label your specimen as a capillary specimen. By documenting that the specimen was collected by dermal puncture, the healthcare provider can consider this when interpreting the results.